The honourable member for Barrie Innisfil.
Well, thank you, Madam Speaker, and I just wish to advise that I'll be sharing my time with the member from Brantford Brant. And let me first also start off by saying thank you to the member from Edmonton Wetaskiwin for his work and advocacy with respect to autism. I believe this is the first time that the Parliament of Canada has dedicated a full day to a discussion regarding autism in this country, and it truly is, Madam Speaker, an historic day. Autism affects more than 500,000 Canadians, and I want to spend my time today talking about the principles of the Canadian Autism Project, about helping families who are dealing with autism, not just in Ontario, but right across the country. And it's important that we look at the principles of the Canadian Autism Project because there are 5 listed in the report that state all Canadians living with autism have the right to, number 1, inclusion, understanding and acceptance, respect and dignity, full citizenship, equitable opportunities and access, and personal autonomy and decision-making. We're very lucky to be here in Canada, where acceptance of differences in Canadians is a trait that we celebrate and practice every day. It's important that government do its part to foster this acceptance, and the Canadian Autism Project, or CAP for short, has brought major stakeholders together to share ideas and practices that will benefit the education and life-learning skills that take longer to learn for those children that have autistic spectrum disorder, simply known as ASD. The origins of CAP go back to the budget of 2015 under Prime Minister Harper that brought the CAP working group together to deliver a report to action on ASD, and the initial budget was offering $2 million. Following the delivery of this report last fall, there was an ask to fund the project further. And in 2017 Liberal budget, Finance Minister and the government ignored that request. CAP was asking for $19 million. Madam Speaker, let's look at the 5 principles and try to make some sense of it all for the government to persuade some members on the Liberal backbenches to support this motion and help Canadian families that live with ASD in their homes. The first principle states inclusion, understanding and acceptance. Madam Speaker, as I said, 500,000 Canadians are living with ASD. Each one of those Canadians are individuals, and they each have their own personalities, interests, talents, and most importantly, they all have tremendous potential. I can't overstate the importance that each Canadian with ASD is given every opportunity for that potential. And sadly, though, Madam Speaker, this is not the case across the country, as depending on which province you live in, the diagnosis and treatment and potential for others and each child differs. In Ontario, intensive behavioral intervention, IBI therapy for children over 5, was eliminated, leaving thousands of families struggling to get the treatment that they need. There needs to be an understanding at every level of government about the needs of the children and families when it comes to the diagnosis and treatment of ASD. The second principle of CAP is one of respect and dignity. Living with ASD is not easy on the family, and especially on the child that's been diagnosed. Life is different for those that have ASD. Between 50% and 70% of those with ASD will have a mental health condition, and to have ASD also means that the child may not understand what is happening to them or know how to compensate or handle it. Making sure that there is proper treatment across Canada will help ensure that the children will have the sense of dignity that almost every Canadian feels. Number 3 of the principles is full citizenship, and for Canadians, full citizenship means that every person should have access to all services available to them for a correct diagnosis, treatment, and the best possible life. The cost of caregiving a child with ASD is up to $5.5 million. All levels of government need to work together to provide education, healthcare, and potential, 3 things that every parent expects to be able to have their child have access to. The 4th principle, as noted in the CAP report, is equitable opportunities and access. The principle is demonstrated with the Canadian Autism Partnership Vision Statement, and it states, all Canadians living with autism have the opportunity to lead fulfilling and rewarding lives and are able to access the necessary supports and services in a welcoming and understanding society. Autism is the fastest growing diagnosed neurological disorder in Canada, and there's been a 100% increase in positive diagnosis in 10 years. 1 in 68 children are now living with ASD, up from 1 in 190. Boys are now 5 times more likely than girls to be diagnosed, And in Ontario in 2016, for example, there was a wait list of 2,192 intensive behavioral intervention and almost 14,000 for applied behavioral analysis. What the CAP is going to do is create a national platform for multi-sectoral collaboration and innovation to drive systemic change. The CAP approach creates opportunities for many autistic individuals, along with their families and caregivers, to benefit from the efforts of decision makers to have a better coordinated and timely support. Children with ASD can have reduced isolation and less frustration in their search for the best intervention and care. The last principle is personal autonomy and decision-making. Every child is different in their approach to how they will learn, react, and be the child that their parents knew they could be. Parents do not lose faith in their ASD child. Sadly, it's governments that act like they do. Decisions made by governments have created an excessive wait list for individuals seeking a housing placement. Parents are forced to drop their children off at social services offices given their lack of alternative options. Decisions by the government created the lack of support of dual diagnosis centres across Ontario, and these centres provide needed support to families of children with ASD dealing with multiple diagnoses. For example, ASD with epilepsy, ASD with Tourette's syndrome, etc. And funding decisions in Ontario have increased the need for vocational support training to create more inclusive workforces. Madam Speaker, let me wrap up with the few minutes that I have to emphasize just why this motion should pass and this government should grant the $19 million over 5 years requested by the Canadian Autism Partnership. And, as the motion states, passing the motion would support families and address key issues such as information sharing and research, early detection, diagnosis, and treatment. I know that $19 million is not going to resolve the crisis that is autism and treatment for our children, but this money will do, what this money will do is going to allow the Canadian Autism Partnership to go forward over a 5-year time frame. The funding and 5-year period will go to the startup, operation, costs to address the complex initiatives. As I stated earlier, some provinces assist families with autism better than others. It's time that nationally we have a framework and group of amazing organizations, community groups, and centers of higher education working together. If we can do this, then we can, in an exceptional manner, affect Canadian families facing ASD. With a comprehensive and united national effort, governments can ensure early identification, early intervention, employment, interventions and service to the best quality of life at all ages, specialized medical care, access to dental and mental health care, education leading to a transition to work, post-secondary school, and most importantly, a successful independent lifestyle. This House and its members can make the mission of CAP a step closer to reality, and that would be to accelerate systemic change at the national level by mobilizing multiple sectors to address complex issues related to autism using a shared leadership approach to achieve collective impact. Madam Speaker, I ask that all members of this House undo the wrong of the 2017 budget and support the work of the working group and grant the Canadian Autism Partnership the $19 million it needs. And Madam Speaker, on behalf of Barrie Innisfil families, and I've met with many of them, whose families are dealing with issues of autism, the 5 of us in the Broussard family would be more than happy to put our 10 cents each in, 50 cents from our family. As the member said from Edmonton-Waskett, it's only 10 cents per family. That's what this funding represents. I have 50 cents on my table here, Madam Speaker, and I would be more than glad to put it towards this project. Thank you.